Welcome to this special edition of the eClinicalWorks podcast, live from the 2022 eClinicalWorks and Hilo National Conference. I'm Adam Stilati. Now, as a whole patient program focused on engagement and prevention, chronic care management, or CCM, is usually seen as a good starting point toward value-based care because it's often described as things the practice is doing anyway. But is there more to the story, and what could convince patients to join a program where the perception might be that they're already receiving these services, the same care anyway? Joining me to speak with us about this question is Monica Salopek, practice manager at our Acadiana Health and Wellness in Lafayette, Louisiana, to discuss the importance of chronic care management and how she successfully launched their CCM program. Monica, thanks so much for being here today.
Thanks for having me, Adam. Appreciate it.
So Monica, tell us a little bit about why did you decide to participate in the chronic care management program, and what role does CCM play in your practice?
Excellent question. When CMS rolled out chronic care management back in 2015, we looked into ECWs having the module already in the chart. And we quickly realized that this was something we were typically doing in a very generalized fashion with our patients. So we took it as an opportunity to basically work a little bit more one-on-one on patients. I have a care management background, so I basically took that workflow and I implemented it into our practice so that we could have that individualized approach, mainly because these type of diseases have a lot going on in their patients, so it's important that they have issues that don't fall through the cracks, and you kind of have to stay on top of it. And those patients typically need a little bit more one-on-one care and an extra eye on them pretty much all the time.
Absolutely. So some offices, often we hear that offices are worried that patients aren't going to agree to participate in the CCM program because the patient may now be responsible for a copay for these services. Of course, secondary insurance can take care of that. But these patients might have thought that, well, I was getting these services for free before. So what are your thoughts on that, and how have you handled that question?
One of the things that we arrived at very quickly was that it was so important to communicate to those patients. Communication is the key, whether it be through paper, on a flyer, explaining to them the services that your office promotes, or that communication through the patient portal. We utilize that a great deal. And it was also a backup and reinforcement of the communication that already took place in the office. So our providers were really the ones who or the driving force. They're the bus drivers when it comes to basically initiating the discussion with the patient at that Medicare annual, because that's when you want to talk about preventing those issues that cause those revisits, to the emergency room, unnecessary admissions to the hospital, that sort of thing. We also explain to the patients that this is treated no different than a claim that they would normally get by Medicare. We explain to them that this is non-face-to-face, meaning these are things happening behind the scenes for the care of that patient, whether it be the referrals that they're getting to their specialists, collaboration with our providers to specialists, to the pharmacy companies, to the pharmacies, local pharmacies, as well as all of the staff within the office. That collaboration was involved in that claim. So we explain that to them. Most of them have no problem enrolling because Medicare typically is picking up that 80% once they meet the regular deductible that they would on any other claim that they had. So it really wasn't an issue. And if it is, we again have some documentation explaining that to them. So again, that communication from the very beginning to the end with the patient is the most important.
Absolutely. Being on the right page, good communication, I think, is key. Now, you kind of hinted at some of the resources that you use there to have that communication with the patient. Can you go into a little bit more detail about some of the resources that you've created and that you use with your patients?
Sure. Again, we start at the Medicare annual because that is the most appropriate visit to initiate that conversation. When patients come in, we provide the flyers. These are flyers you get off of CMS.gov. It's available to everyone. It doesn't cost anything. We provide that to the patient, gives them something to read and look at while they're in the waiting room. We also have some TVs that have Patient Point, which is a company that provides a free service that you can put your campaigns on. Patients are seeing seeing that. When they go in the room, they should already have a little bit of an idea of what that's about. So when the provider talks to them a little bit about enrolling in CCM, which is usually less than a minute conversation, they're usually like, sure. Because, the old saying, they have this relationship with that provider for so long in primary care that pretty much whatever that doctor says or that provider says goes, and they'll listen to them. We learned that in a very cyclical fashion, because we used to do it on the back end where we would call the patients after the visit. Now we do it on the front end because we were more successful with the provider having that conversation. And again, they leave with information in regards to CCM. They get a follow-up notification in their patient portal. And if they have any questions when they get a bill and they forget, because our population is an elderly population, and they forget 30 days later or 60 days later when they get that invoice, then we can reference it through letters that we have already as templates in the system, reminding them of what this is about and what they're receiving for this service. And they typically prefer that it be the provider and our office staff that provide these services. We quickly realized it was not necessary to send out to a third party because A, we are already providing the service, so why have to redo it over and over again and give it to someone else? But also our patients responded more quickly to us versus a third party or a call from a third party provider, or they're getting called from secondary insurances, they're getting calls from all over the place. Once you hit 65, everybody calls you. So, once they got that, they have that relationship with us, it's not necessary for them to have to go into a third party system. It just didn't make good sense to do it that way.
Now, I want to ask you more about that third party bit in just a little bit. But before we get there, I think in one of the conversations you and I had, you had mentioned something about a checklist or like a list that the provider walks through with the patient about what's covered under CCM. Can you tell us about that?
Correct. So what we did is we explained those services that are provided to them, and the provider explains that to them is that, we're doing a lot of behind the scenes type work. Basically prior authorizations, getting your medications approved, talking with other doctors, facilitating their care. They might have 7, 8, 9 providers, specialists involved in their circle of care. All of these things are put together in a care plan, an individualized care plan for those patients. So that takes a lot of time for that patient. And we also have to identify obstacles and goals for the next year with that patient. So it's important that that provider shares that information with them and that they can see them. So he kind of goes through that with the patient very quickly, but they also have a piece of paper in front of them. They also have the information on the patient portal to back up that conversation. They can reference it so that if they happen to call back or send a message through the patient portal asking, what is this for, we can explain it again in more detail. And it's also indicated in the chart notes, so we have that there. But they will have that information directly in front of them. We also have like a little module, electronic module in the exam room where they can click on and see all those services that are provided as well.
So since you've been doing CCM and since you started with that several years ago, it's been some time now, what outcomes have you seen? What's been the result of your participation in the CCM program?
So when we changed the workflow from the nurse calling them at the end of the visit and enrolling them, and we switched it to the provider enrolling at the beginning of the visit at the annual, we quickly realized, and the provider realized, that it was truly important to have that follow-up contact with that patient. So one of the things that the providers started doing was having like Friday calls or Thursday calls on maybe some acute care issues that was going on with that chronic care patient on Monday or Tuesday, or even the week before. It was kind of just to make sure they were tucked in and everything was good on Friday, so they didn't have to go again to an unnecessary ER visit or urgent care visit. This prevented a lot of falls, dizziness, things that caused that. We were able to track that, and one of the first things that came up was our low readmission rate. And so we started looking, and we noticed that most admissions took place on Fridays. And that still is the case now across the board. So we realized that was an important factor. And as soon as we implemented just that concept, it was amazing because those readmission rates dropped. And also the opportunity of that patient to have that direct communication with that physician via the patient portal. if you think about it just from a human standpoint, the fact that you have an opportunity to call your primary care doctor, maybe you don't need him, you may not ever need him, but the fact that you can send a text message and know somebody's going to return it over the weekend, that gives a lot of, brings a lot of reassurance to a lot of our patients. They don't necessarily all use it. Some do, more than others, but it does give them so much reassurance. So again, an unnecessary visit or surge to the emergency room, that prevented a great deal of that. And we saw that almost immediately within the first few months of transitioning to the provider's implementation.
And of course, I think the CCM program is important in the fact that it really supports those activities, right? You're not worried about, losing out on revenue because you're dedicating the time that this patient needs
Correct.
to be able to provide for their care.
Correct.
But that you're maybe not billing a direct face-to-face visit for. You're being supported through the CCM program. So I think
Correct.
that's really important. Now, yours is a smaller office. You've got one provider, one nurse practitioner, and you did talk a little bit earlier about the third-party services. Now, many groups use that. Why didn't your office choose that route? Why didn't you go with a third-party service to run your CCM program?
Well, that's an excellent question, Adam. We already had a workflow in place, and we also didn't feel like we needed to go out and hire more staff. We were able to look at the personalities in our office. And I use the word personalities because I think it's important to realize that when you look at your office staff, you have to analyze and see who has the better talents in certain things and who can communicate better for patients. So although your LPN might be more qualified, your LPN might be better doing prior authorizations than the one actually reaching out and calling patients or getting on the patient portal and communicating. So we utilized our staff that we already had. We put them in position to be successful with the relationship in that patient and also with that case management and what they were comfortable in. Because in a regular acute care office, we're just putting out fires. This is that arm that extends from that visit when you have that annual visit to that next follow-up visit and what takes place in between. So it takes a special person to reach out and make sure they have that continuity of care along the way between the visits. So when we realized that we had that workflow there, we really didn't see a need to refer out. And then again, we already have that established relationship with the patient there through the primary care office. We've been treating these patients for 15 years at that time, now 22 years. So those patients trust us. They know who's on the other side of the phone. They know who's on the other side of that telephone encounter or web encounter. So they have a more comforting position with us as well and are also better able to display their problems and issues they're having. They might be more likely to tell us, I can't afford $800 a month, that's why I didn't take that medicine. They might not tell somebody that they've never talked to before, that sort of thing. So we really didn't feel that it was appropriate to do it at that time. And ECW already had the module for our documentation in the chart. So from a care management standpoint, I could see everything that was happening. I could see all the logs. I could see everyone's work. And it really was a team-based approach. That's what we wanted. So that's why we didn't seek out third party.
Well, Monica, it sounds like you've been doing great work with that. You're really supporting your patients. Another interesting point that you mentioned there, about patients who might not be able to afford things or patients who maybe have difficulties with transportation, things like that. I think it's great that the CCM program also allows you to really kind of spend time helping patients to navigate those challenges as well as rather than saying, well, they're going to have to figure it out, right?
Right.
So it's excellent that you're participating. I'm glad you've had so much success. And thank you so much for taking the time to speak with us this morning about your experiences.
Thanks for having me. Appreciate it.
Well, if you'd like to learn more about any of our products that we've discussed here today, like chronic care management, you can check out my.eclinicalworks.com. But of course, make sure you check out our other eClinicalWorks podcast episodes on Apple Podcasts, YouTube, and my.eclinicalworks.com. For the eClinicalWorks podcast, I'm Adam Silati, and thanks for watching.